So this young woman has a very painful bump that is oozing, that is liquefied and is oozing on the side of her face. I'm sure that is extremely painful. She calls this cellulitis, but that is not really what this is. And so let me explain. Let me show you what cellulitis looks like. So this is from one of my dermatology textbooks. This is what cellulitis looks like. It is inflammation around the subcutaneous tissue, and I will tell you, I can't remember the last time I made a diagnosis of cellulitis in my practice, that it's not a common diagnosis that we see in private practice. You might see it in hospitals and admitted patients, but I don't see cellulitis. Let's go back to what this is. If she had a bump there to begin with, which is what I suspect, maybe she had a cyst and it became inflamed. It does not mean that an inflamed cyst is infected. But sometimes a cyst can just rupture under the skin. If it breaks under the skin, it's called a sterile abscess or a sterile inflamed cyst. Really, process is as if a cyst ruptures under the skin, it can incite inflammatory reaction. Your body just kind of recognizes, oh my gosh, there's something that is in our skin, a foreign body, and all your macrophages, your white blood cells, and everything kind of comes and attacks it and tries to push it out. So in the office, we would numb that area up first and really do an IND, an incision and drainage, and try to drain that liquid really, and that will relieve some of the symptoms. Sometimes we give you antibiotics because it's just scary to have a really red bump there and hope it's not involved with bacteria.